Good morning. My name is Daniel Nelson, and I'm an assistant chief with the Seattle Police Department overseeing the Metropolitan Safety Services Bureau. Today, I'm testifying in support of House Bill 1816, which aims to advance civilian-led civilian staff crisis response team as first responders to 911 calls for service. Alternative responses to non-criminal 911 calls is crucial for ensuring that individuals in crisis receive the most appropriate care while allowing law enforcement to focus on serious public safety concerns. In essence, it allows officers to respond more quickly to actual versus imagined threats to safety. Historically, police officers have shouldered the responsibility of responding to a wide range of calls, including those related to mental health care, homelessness, substance use issues that often require medical, social, psychological interventions rather than criminal justice response. The city of Seattle has seen amazing results of its initial care deployment. From October 26, 23 to November 2nd, 24, the Seattle Care Team were present at 918 events, 720 which were requested by sworn SPD staff. They facilitated 317 transports from the scene. They spent an average of 37 minutes for each call and had an 11-minute response time. All of this great work was accomplished with a limited deployment area, only 2 out of the 5 precincts which serve the city, and a limited staff base. The transition from a traditionally law enforcement-centric response to that an alternative response must be carefully account for safety concerns, coordination between agencies, and the body of work that has fallen under policing, ensuring that new approaches are well-resourced and effectively integrated into emergency response systems. And just to answer some questions around, I heard earlier about safety issues. The difference is, and this is what we did with our training, and we rolled out e-learnings, and Chief Barnes did an amazing job with her team addressing roll calls and talking about what is that interplay. If an officer gets to a scene and it is safe, they can call care responders in and they can assist with problem solving, all that other stuff. Conversely, if care responds to a call and it's not safe, and let's say there were no threat factors present on the front, and they get there like, I don't feel good about this, and I think I need a cop, they can simply back out and call for SPD to show up, and then they will show up to make the scene safe. Another question that was brought up is, this is important because it's a scale issue, specifically in the city of Seattle. So the city of Seattle SPD responds to anywhere between 9,000 and 12,000 calls, crisis calls per year. Okay. We do have a very robust co-responder program. We have 5 co-responder teams. We have a extreme high engagement with our CIT programming that offers 40-hour training. But CARE just acts as more scale to be able to meet the needs of our community. Thank you.
Thank you very much, Dan. Any questions for Dan? You heard from the Washington Council of Police and Sheriffs as well as Teamsters 117. Any, I guess, is there a path forward in working out the unionized labor issues with what you are dealing with day in and day out? Because it is a huge challenge in Seattle, as much as I love Seattle, for you all. Have you engaged with them, or is there a path forward, do you think?
With the union, I think there is a path forward. It's just, as mentioned, our bargaining cycles are extremely long. And so it's we have need now. Our entire mental health delivery system needs a lot of work. So we all need to start moving in the same general direction. And again, we are very appreciative of the cooperation we have received with the Seattle Police Officers Guild. It's moving at a very slow pace, and we have proven that the rank and file appreciate the service and they leverage the service. And we have in King County a great many community members and very limited social supports to help supplement police and fire responses. For instance, the mobile crisis team is a great program. It's a King County initiative operated by DESC, but they are responsible for the entire county, and we were getting upwards of 2 to 3 hour response time estimates. When we're calling for partners in problem solving these very complex behavioral health centric calls, whereas again the CARE team is there in 11 minutes. And so it's been very, very well received by our officers and supplemented with our in-service training. Again, we have a policy on it. We do e-learning trainings. This year it's incorporated in our We do 8 hours of annual CIT training in the city of Seattle. So we have some scenarios where we're practicing, interacting with the care team. So we are taking all of that into consideration because it is a very complex dynamic which we're trying to figure out the orchestra on. But it is going well.
Great, thank you. Is it helping to have that 11-minute response versus 2 or 3 hours response that you see of your cohorts elsewhere for you to stay on the job?
Absolutely. I personally have been, on calls where I see someone in behavioral crisis, and I engage with them, I de-escalate them, I ask them if they want or need any social services. Say yes. This is pre-care. I would call the number, and again, you get that 2-hour ETA, and say, okay, well, I can't hang out on the scene for 2 hours because there's other 911 calls for service happening. I give the operator, what's this person's name, this is where they're going to be, this is what they look like, this is how they're dressed. And my hope is that they hang out for 2 hours for the MCT to show up to provide them the critical services they need. But, I'm not overly optimistic that happens at a very high occurrence. So yes, to answer your question directly, 11 minutes response time is very good. And again, that's with the limited staffing that they started with.
Great. Thank you so very much for your testimony and answering many of our questions. I appreciate it. Next, please, Vice Chair Close.